Good day, class. I am Beverly Ann Calva. You can call me Teacher Beth. I hope everyone is ready for another meaningful discussion. Today, we will begin exploring a very important topic, which is health literacy. This topic will help us understand why people experience different levels of health and wellness, and how our ability to understand and use health information affect the decision we make every day. Before we begin our lessons on health literacy, I want you to participate in a quick activity with me. I want you to think carefully and answer out loud or write your answer on a piece of paper. I'll show you two situations. All you must do is choose who you think has a better chance at staying healthy, the person A or person B. And then tell me your reason. Ready? The first scenario, person A can clearly understand medicine labels or instruction. Person B always finds health information confusing and difficult to follow. Now, who do you think is more likely to stay healthier? Person A or person B? Correct, person A, because if you understand health information, you can avoid mistake and take care of yourself properly. Health is not only about what we choose to do. It also depends on whether people have access to information, clean water, health services, and many other factors. And that, class, is exactly why health literacy is important and why we need to understand the social and economic factor that influence a person's overall well-being. Before we dig deeper to our discussion, let's define health literacy first. Health literacy is the ability to understand and use health information. It is more than just knowing medical terms. It's about understanding health information and using it to make good decisions for us and others. The Healthy People 2030 framework identifies two components of health literacy. First is person health literacy, the degree to which individuals can find, understand, and use information and services to make informed health decisions for themselves and others. The second is organizational health literacy, the degree to which organizations enable people to find, understand, and use health information and services fairly and equally. In simple words, health literacy means having the knowledge, skills, and confidence to take care of your health and make responsible choices. Now that we understand what health literacy means, let's see how it connects to social and economics factor that influences how healthy people can be. Social and economics factors are the conditions that influence how well and how long people live. These factors affect our ability to make healthy choices, afford proper food and housing, manage stress, and access medical care. That means our environment opportunities and living conditions are just as important as our personal habit. Let's explore the 7 examples of social and economic factors. The 7 factors affecting health. Number 1 is education. Education is described as one of the most basic and essential social economic factors because it significantly influences future opportunities, including jobs, income, and access to information. Individuals with higher educations typically have a stronger problem-solving skills, better health awareness, and more confidence in navigating the healthcare system. Example, a college student who understands medications levels can take medicine properly, avoid incorrect dosage, and make safer health decisions. But someone who has difficult reading or understanding medical terms may become confused, which can lead to health risk. The second factor is income. Income directly determines the quality of food a family can buy, the kind of house they can live in, the medical services they can afford, and even the environment they grow up in. Higher income opens more health opportunities while low income greatly limits healthy choices. Example, a high-income family can afford regular medical checkups, nutritious meals, vitamins, and clean living spaces. Meanwhile, a low-income family may be forced to eat cheap, processed food, delay medical treatment, or live in overcrowded housing. Question: if you only had 100 pesos left today, what healthy item could you buy? Good choices. The banana, boiled egg, and water are cheap one but nutritious. These activities demonstrates how income shapes daily health decisions. Higher incomes allow people to buy nutritious food, pay for doctor's visit, and live in a safer environment. Meanwhile, low income limits access to these things, increasing the risk of malnutrition or illness. It explains that there is limited research showing how changes in economic conditions affect long-term health outcomes. This is because health changes do not happen overnight. They take months or years to appear. Example, when the government increases the minimum wage, researchers cannot immediately conclude whether people's health improve. They must wait and study patterns such as changes in nutrition, stress levels, or hospital visits. The fourth factor is occupation, or the kind of jobs you have. Occupations affect both physical and mental health. Some jobs expose workers to chemicals, injuries, and exhaustions, while others can cause stress or sleep deprivation. Unemployment, on the other hand, can lead to anxiety, depression, and health financial strain. Take a look at these examples. Miners and construction workers face physical hazards every day. Call center agents may suffer deep disturbance and high stress. Unemployed individuals often experience emotional stress and may lack access to healthcare benefits. Miners face the most physical hazards like accident, dust exposure, and long hours underground, which increases health risk. Delivery riders also face risks like traffic accidents, fatigue, and stress from tight schedule, but in general, less hazardous than mining. Teachers, while they may experience stress or voice strains, generally work in safer environments which lower physical risk. This shows us that our occupation directly influences our overall health, not just physical, but mentally too. Choosing safe work practices and managing stress are important no matter what job you have. The fifth factor is social economic status, success, and social environment. This means the peoples around us, such as family, friends, classmates, and neighbors, they influence our behaviors and health. Example, if your friends exercise regularly, you are encouraged to do the same. If your environment normalizes smoking or drinking, you may feel pressure to follow. Families with strong support systems help reduce stress. Who in your social circles influence your health habits? Good. If you have a supportive sister who eats healthy and exercise, you're likely to do the same. But if your social circle smokes or drinks often, you might copy that behavior too. That's why surrounding yourself with positive and supportive people is good for your well-being. The sixth factor is access to health care. There are 36% of the world lacks access to improved sanitation, which put them at a high risk for diseases. Access to healthcare is not just about hospitals. It includes clean water, vaccination, clinics, and sanitation. Example, people in rural areas often travel long distances to see a doctor. As a result, diseases that could have been treated early become more dangerous. Question: what do you think prevents many families from accessing healthcare? Correct. that transportation costs and long distances are the barriers affect overall health. That's why health programs like PhilHealth, Barangay Health Station, and free vaccination drives are so important because they help everyone stay healthy, especially the poor. Finally, we have poverty. What comes to your mind when you hear the word poverty? Yes, lack of money. Those are all true. But poverty is more than just a lack of money. Poverty means not having enough resources for basic needs like food, water, housing, and healthcare. For example, a child growing up in a poverty might skip meals or drop out of school, which later affects their health and future opportunities. Poor families often live in areas with more pollution, unsafe water, and less medical support. In fact, poverty is the most severe barriers to good health. It affects everything: education, nutrition, shelters, clean water, healthcare, and job opportunities. People living in poverty often face continuous health challenges. That's why fighting poverty also means promoting better health for everyone. Our health literacy helps us recognize that good health depends not only on personal choices, but also on the conditions where we live in. These 7 factors shows that good health is not solely a personal responsibility, but a result of the environment, opportunities, and resources available to us. People make better health decisions when they have proper education, support system, healthcare access, and safe living condition. As future educator, it is our duty to promote awareness, guide our students and communities, and help them understand how their surrounding influence their health. When people gain knowledge, they gain power. The power to protect themselves, improve their lifestyle, and make informed, responsible decisions. Health is not only about what we do, it is about the opportunities, education, and environments that allow us to live well.
Good day, class. My name is Miss Juliana Carril Zapeda. You can call me Teacher Jules. Today, we will explore an important topic that affects every Filipino, our healthcare system. Have you ever visited a hospital or health center? How was your experience, class? Great! Our topic for today is health system and practices in the Philippines. You should be able to describe how our healthcare system works, identify its challenges, and appreciate the role of healthcare workers in keeping our nation healthy. I have here some pictures. Can anyone tell me what you see? What do you think these images have in common? Very good! These are all part of our healthcare system, the people, places, and organizations that help us stay healthy. To start, let's talk about how healthcare works in the Philippines. In general, the healthcare system in the Philippines is considered to be one of high quality. One of its biggest strengths is its medical staff. Filipino doctors, nurses, and health professionals are highly qualified and recognized globally. Then, urban versus rural healthcare. A major characteristic of our healthcare system is the inequality between urban and rural areas. Public healthcare in cities like Manila or Cebu is generally excellent. There are more hospitals, more doctors, and better equipment. But in rural areas, access to quality healthcare remains a challenge. Some areas lack specialist facilities or equipment. This creates a gap where people in far-flung communities may need to travel long distances just to receive proper treatment. In your opinion, class, which one do most Filipinos rely on and why? Very good. Then let's talk about the dependence on public healthcare. Millions of Filipinos rely on public healthcare, but because many medical professionals choose to work abroad, some hospitals here become understaffed, leading to longer waiting times for patients. Then, PhilHealth rule. PhilHealth is the main health insurance provider in the country. It covers many treatments but not all, so some families still face out-of-pocket expenses. Then the Universal Healthcare Act. In 2019, the Universal Healthcare Act was passed. This law automatically enrolls all Filipinos in the National Health Insurance Program and expands PhilHealth benefits to include consultation and lab tests. In summary, the Philippine healthcare system is improving, but issues like unequal access and understaffing remain. With ongoing reforms, the country aims to achieve better and more inclusive healthcare for all. Class, do you understand the lesson so far? Any question? Alright, if there are no questions, let's move on to the next topic. Health Management Organization or HMOs. HMOs play an important role in linking private and public healthcare across the country. What are HMOs? HMOs are private healthcare providers offering a wide range of medical services to their members. Unlike general private providers, HMOs operate using a network of doctors and hospitals assigned to patients. Patients enrolled in an HMO are typically assigned to certain doctors or facilities within this network. The HMO reimburses providers based on a specific system, ensuring coordinated care and cost management. HMOs in the Philippines. Most employees in the Philippines benefit from HMOs because these organizations are commonly included in employer benefits packages. The system helps employees access healthcare efficiently while controlling expenses. HMOs complement PhilHealth, which is the government health insurance system. While PhilHealth covers basic costs, HMOs provide additional coverage for services and expenses not included in PhilHealth. Any question, class? Alright, if there are no questions, let's talk about how healthcare in the Philippines is funded. The Philippines created the PhilHealth program in 1995 to provide universal healthcare coverage at affordable rates. PhilHealth is a government-run organization funded through several sources. First, contribution from employees and employers. Second is the subsidies from local and national government. This multi-source funding lets PhilHealth offer a variety of medical plans tailored to people's income, age, and health condition. Then, PhilHealth membership categories. PhilHealth serves diverse groups through 6 membership types. First is the sponsored members, individuals subsidized by their local government unit. The second is indigents, those with no or very low income. Third is a lifetime members, retired and pensioner over 60 who have paid premiums for at least 120 months. They no longer pay premiums. Fourth is the senior citizen, some elderly over 60 eligible for free coverage who don't fit into other categories. Fifth is the formal sector, employees working in both public and private sectors. Lastly, the informal economy, self-employed migratory workers and those outside the formal job sector, often chosen by expatriates. Each category allows PhilHealth to reach as many Filipinos as possible under specific financial and social conditions. In summary, HMO are private healthcare providers working with a network system often included in employer benefits. PhilHealth is a government-level universal healthcare funded by combined contribution. Both systems work together to ensure Filipinos receive broad and accessible healthcare coverage. Moving forward, we'll talk about the differences between private and public healthcare in the Philippines, healthcare issues in the Philippines, and the best healthcare jobs in the Philippines. Private healthcare. Private hospitals in the Philippines are known for being cleaner, more comfortable, and faster when it comes to service. Staff are often multilingual, which is great for expats and medical tourists. Private care is so trusted that almost 30% of Filipinos use it as their main source of healthcare, and nearly 60% of hospitals in the country are privately owned. Public healthcare. Many public hospitals, especially those in major cities, offer excellent care and reliable diagnostic services. But the reality is that this quality is not consistent everywhere. Some public facilities, especially in rural areas, still struggle with limited equipment, long lines, or staffing shortages. That's why locals usually recommend which public hospital offer the best care. My question, class: why do many Filipinos prefer private hospital even though public healthcare also exists? Very good explanation. You clearly pointed out the main reason why people prefer private hospital. Next, we will talk about the healthcare issues in the Philippines. First is the brain drain. This is when highly skilled professionals leave the Philippines to work abroad, and it's a major issue. The country has only one doctor for every 33,000 people, which is way below global standard. It's not just doctors, dentists, midwives, and many other essential workers are also in short supply. Second, shortcomings in addiction treatment and care. Another concern is addiction treatment because of strict anti-drug operation and overcrowded facilities. Doctors often don't have enough time to give proper therapy to patients. Third is the slow emergency response. We also face issues with emergency response. Ambulance services vary a lot across the country. Some arrive quickly while others take too long because of weak system and limited regulation. Private ambulances tend to have better equipment, more trained staff, and faster response times, but they can be expensive. My question, class: how do the current healthcare issues like brain drain and slow emergency response affect the overall health services in the Philippines? Excellent answer. You connected the issues to the real impact on healthcare services. It's important to understand that these challenges affect not just hospitals but the whole community. That concludes our discussion. Thank you for listening and hope you learned something today.
Good day, everyone. I am Teacher Shane. Today we'll be talking about something that affects all of us at some point, like common ailments, their causes, and how to treat or prevent them. So first, we have the cold and other upper respiratory condition. So have you ever had a stuffy nose or sore throat that made talking or breathing hard? Okay, that's what we call upper respiratory condition, which include the common cold, flu, and bronchitis. These illnesses can be caused by viruses and bacteria, and symptoms include cough, fever, fatigue, and nasal congestion. To prevent them, practice good hygiene like washing your hands, cover your mouth when sneezing, and get your annual flu shot. So always remember, a healthy lifestyle and cleanliness are your best defense. So question, how can we prevent these illnesses? Great job! These habits reduce the spread of viruses. Washing hands removes germs, covering your mouth prevents droplets from flying around, and a flu shot prepares your immune system. These simple steps protect everyone. Second is fatigue. We all feel tired after a long day, but constant tiredness isn't normal. Fatigue can be caused by stress, lack of sleep, anemia, infection, or chronic diseases like diabetes. To fight fatigue, make time for rest, eat balanced meals, and exercise regularly. If exhaustion continues even with enough rest, it's time to visit your doctor because fatigue might be a sign of something more serious. Third is headache. Headaches can be dull, sharp, or pounding. They can be triggered by stress, dehydration, lack of sleep, eye strain, or even certain foods. To manage them, know your triggers and avoid them. Drink water, sleep enough, and manage stress. If headaches are severe or frequent, consult your doctor. So question,
How can we prevent frequent headaches? Good answer. Healthy habits are key. Staying hydrated and sleeping well helps prevent tension in the body. Managing stress also keeps headaches from coming back often.
Rush. A rush is your skin way of saying something is wrong. It may be caused by allergies, insect bites, heat, or inheritance like plants and chemicals. Avoid scratching, keep skin clean, and use mild creams or cold compresses. If a rash spread quickly or come with a fever or swelling, you should see a doctor. So question, when should we see a doctor about a rash?
Very good. These symptoms show that the rash might be due to infection or a strong allergic reaction. A doctor's help is needed to prevent it from getting worse. Next is infection. Infections are caused by bacteria, viruses, fungi, or parasites. Common examples include ear infections, eye infections, skin infections, and food poisoning. Symptoms include fever, pain, swelling, redness, and fatigue. Remember, antibiotics only work for bacterial infection, not viral ones. Never self-medicate. Next is back pain. Back pain is common, especially among those who sit for long hours, lift heavy objects, or have poor posture. Common examples include ear infections, eye infections, skin infections, and food poisoning. Symptoms include fever, pain, swelling, redness, and fatigue. Remember, antibiotics only work for bacterial infection, not viral ones. Never self-medicate. Next is back pain. Back pain is common, especially among those who sit for long hours, lift heavy objects, or have poor posture. It may be caused by muscle strain, arthritis, or spinal disc problem. Heat or cold compresses, stretching, and rest usually help. Persistent back pain, however, needs medical evaluation. So question, what are some common causes of back pain? Correct. These are everyday causes. When we improve our posture, avoid heavy lifting, and stay active, we can reduce the likelihood of back pain. In conclusion, common ailments may seem minor but can affect on our daily comfort and productivity. Understanding their causes and treatments help us act early and avoid complications.
So good morning class. I am Teacher Caster. So now, let's begin with a simple question. What do you think is the first thing you should do when someone suddenly gets injured or faints? Those are great answers. Yes, knowing what to do first in an emergency is very important. That's why today, we'll be talking about first aid, especially the DRSAPC action plan, which help us remember what to do step by step in any emergency. To help you understand better, let's start with a short video showing how first aid works in real-life situation.
Are you choking? Cough it up! Back blows create a strong vibration and pressure in the airway, which is often enough to dislodge the blockage if a child is choking. Dislodging the object will allow the child to breathe again.
Okay class, based on the video you watch, why do you think staying calm is important in giving first aid? Exactly. Staying calm helps you follow the step correctly and keep the injured person safe. So, what you have seen was to do first aid on someone choking. But now, let's discuss each step of DRABC one by one. First is D. D is danger. Always check the area first. Make sure it's safe for you and the injured person and others. Never rush in if there's danger, your safety comes first. Next is response. Check if the person is conscious. Talk to them, gently tap their shoulders, or squeeze their hand to see if they respond. So, next is send for help. If there's no response, immediately call for help or ask someone to call or the local emergency number. Always stay calm and follow the operator's instructions. Airway. So, check if the person's mouth and throat are clear. Tilt their head gently back, lifting their chin. If something is blocking their mouth, carefully remove it. B is for breathing. Look, listen, and feel for breathing. Watch the chest for movement. Listen near the mouth or nose and feel for air on your cheek. If the person is breathing, place them on their side to keep the airway open. C. C is for CPR. If the person is not breathing, start CPR. Push down 30 times in the center of the chest, then give to rescue breath. Keep repeating until they start breathing or help arrives. So class, here is a short video showing how to properly perform CPR. Watch carefully so you can see the correct hand position and rhythm.
1, 2, 3, and 4, and 5. 1, and 2, and 3, and 4, and 10. 1, and 2, 3, 4, 15. 1, 2, 3, 4, 20. 1, 2, 3, 4, 25. 1, and 2, and 3, and 4, and 30.
After watching the video, what did you notice about the correct hand position and the rhythm used when performing CPR? Now, let's talk about infection control. In giving CPR, there might be contact with saliva or blood. To stay safe, use a resuscitation mask if you have one in your first aid kit. This protects you from possible infection while still helping the person in need. Now, let's discuss first aid for a person who is choking. If someone is choking, make sure the airways is clear. You may need to carefully roll them into their side to help them breathe. Always be gentle and watch for a possible spine injuries. And lastly, first aid for medication or drug overdose. If you suspect that someone has overdosed, don't let them sleep it off. Some drugs can cause serious harm or death. Call for help immediately so a doctor or a paramedic can check them. So final question, why is learning the DRS-ABC action plan important for everyone, even if you're not doctors? So, okay, good. To end our discussion, remember this. First aid can save lives. You don't need to be a doctor to help someone in emergency. You just need to stay calm, think clearly, and follow the DRS ABC steps.
Good morning, class. I am Teacher Hart and I will discuss the dangerous drug abuse and its treatment. Before we begin, let me ask you a question. What comes to your mind when you hear the word drugs? That's right. Drug abuse can either help us or harm us, depending on how they are used. Today, we'll talk about dangerous drug abuse and its treatment. Drug abuse means using drugs in a way that is harmful to one's health, behavior, and life. Some people start using drugs out of curiosity, peer pressure, or to escape problems, but later, it becomes addiction. Question: Why do you think some young people get involved in the drug use even if they knew it's harmful? Exactly. These are common reasons why people fall into drug abuse, but remember, no reason is worth destroying your future. Now, what happens when a person abuses drugs? Drug abuse can lead to serious physical and mental health problems such as brain damage, heart and liver disease, anxiety, depression or hallucination, poor decision making or criminal behavior. Question: can anyone tell me how drug abuse affects not just the user but also the people around them? Very good. Drug abuse is not just a personal problem, it's a social issue. Families suffer emotionally and financially, and communities lose their sense of safety. Now, let's talk about treatment. Fortunately, drug addiction can be treated, but it requires strong willpower, support, and medical help. Some treatment options include: first, rehabilitation centers where patients receive counseling and therapy. Second, medical treatment to help manage withdrawal symptoms. 3. Family and community support to encourage recovery. Question: why do you think family support is important in treating drug addiction? Very good. Recovery is a long journey, and the patient's family plays a big role in keeping them on track. Lastly, prevention is always better than cure. We can prevent drug abuse through education, awareness, and by making good choices. Saying no to peer pressure and yes to a healthy lifestyle. So to sum up, drug abuse is a dangerous trap that destroys lives, but with the right help, change is possible. Remember, every decision we make today shapes our future. Final question: if you met a friend struggling with drug abuse, what would you do? That's the right attitude. Care, not condemnation. Together, we can help stop the cycle of drug abuse. Any question, class, before we move on? Okay, that's all for our discussion today. Thank you for listening and participating. Good job, class, but this is not the end of our discussion because Teacher Jenny will continue the discussion.
Good morning, class. I am Teacher Jenny, and today I will discuss health risk ailments and how to avoid them. Class, what do you think will happen to our health if we keep doing these habits? Correct. These are examples of health risk ailments, diseases that can be prevented if we take care of ourselves. Today, we will learn how to avoid them. Let's discuss the 8 healthy choices that will help us prevent diseases. The first one, be a non-smoker and avoid secondhand smoke. Now, who can tell me what smoking does to the body? Very good. That's why we must avoid smoking and protect others from secondhand smoke. Second one, be physically active. What activities can you do to stay active? Excellent. Exercise keeps your heart healthy and strong. The third one, eat healthy foods. Now, who can name a healthy food and unhealthy one? Correct. We should eat more fruits and vegetables and avoid processed foods. The fourth one, achieve and maintain a healthy weight. Now, may I ask, why is maintaining healthy weight important? Correct. To avoid diabetes and heart diseases. The fifth one, control your blood pressure. What can cause high blood pressure? Excellent. Too much salt and stress. The sixth one, limit your intake of alcohol. Now, let me ask you, true or false? Drinking too much alcohol is good for the heart. Correct. It's false. Now, let's move forward to reduce your stress. What do you do when you are stressed? Correct, we should listen to music or take a rest. Last one, be screened or tested regularly. Why are checkups important? Exactly, prevention is better than cure. Very good. Good morning, everyone. Today, we'll discuss our final topic on health literacy, health management, and lifestyle. To start, let me ask, what do you usually do to keep yourself healthy every day? Very good. Eating vegetable, exercise, and sleep early. Those are all examples of health management, the way we take care of our health through our daily choices and habits. Healthy lifestyle management is the study of the theory and practice of whole person health. It's about caring for yourself and others, building good relationship, and appreciating that everything in life, body, mind, and environment is connected. Let's explore some practical tips from the module on how to manage and maintain a healthy lifestyle. The first one, measure and watch your weight. Our first tip is to measure and watch your weight. Keeping track of your body weight regularly, maybe every week, helps you notice if you are losing or gaining too much. Example, if you notice that you are gaining weight fast, it might be a sign to adjust your diet or exercise routine. Monitoring your weight helps you stay aware of your physical health and avoid obesity or malnutrition. Remember, maintaining a healthy weight is not about being thin. It's about being strong, active, and balanced. The second one, limit unhealthy food and eat healthy meals. The second tip from the module is to limit unhealthy foods and eat healthy meals. Our module reminds us not to skip breakfast and to choose meals with more protein and fiber and less fat, sugar, and calories. Instead of soft drink water. Instead of instant noodles, try boiled egg and vegetable. Healthy eating fuels your body and strengthens your immune system. It's the foundation of good health. The third one, take multivitamin supplements. The third tip is to take multivitamin supplements when needed. Supplements help maintain proper nutrient level, especially when we don't have enough fruits and vegetables at home. Vitamins A, B6, B12, C, D, and E, and minerals like zinc, iron, copper, and magnesium are all important for immunity. However, some also warns, especially in our module, that there's no proven evidence that taking miracle supplements can prevent diseases like viruses. In fact, too much of certain vitamins can harm your health. So remember, supplements are helpers, not replacement for healthy eating. The fourth one, drink water and stay hydrated. Next, the module advises us to drink water regularly and limit sugary beverages. Water helps your body function properly, it aids digestion, improves focus, and keeps your skin healthy. If you drink 6 to 8 glasses of water a day instead of soda or milk tea, your body stays hydrated and your energy improves. Reminders that there is no evidence that drinking water in every 15 minutes prevents viral infection, so we don't need to overdo it. The important thing is to stay hydrated naturally throughout the day. Hydration is simple but powerful. Your body depends on it. So everyone, what can we conclude about health management and lifestyle? Exactly, you are right. Health management isn't just about routine or something we do when we are sick. It's a lifelong commitment to making good choices every day. It means caring not only for yourself, but also for others and living with balance in all aspects of life. Health is interconnected. When one part of our life is healthy, like our body, or our mind, the rest follows. That's why it's important to keep all areas such as physical, mental, emotional, and social is in harmony. So, let's always remember to eat well, rest well, move well, and think well. Because that's the true meaning of a healthy lifestyle. Taking care of yourself isn't selfish. It's the first step to living a longer, happier, and more balanced life.